Imagine your eye is a high-end camera lens. When everything is calm, the picture is crisp. But if the iris, the colored ring of your eye, suddenly gets inflamed, it is like someone smears greasy fingerprints on the lens and turns the lights up to maximum. That condition is called iritis, also known as anterior uveitis. Iritis is inflammation in the iris, the colored part around your pupil, and it is a common type of uveitis, which means inflammation in the middle layer of the eye. If it is not treated, it can lead to serious complications and even permanent vision loss, so it is not something to wait out. In this video, I will walk you through the symptoms, the common causes, how it is diagnosed, and what treatment usually looks like. Iritis often shows up with eye pain, a red eye, blurry vision, and sensitivity to light, meaning bright light feels uncomfortable or painful. It may affect one eye at a time, especially in acute cases, and symptoms can build over hours to days. Some people also notice a smaller or slightly irregular-looking pupil on the affected side. Here is the key takeaway. If you have a painful red eye with light sensitivity or new blurry vision, treat it like an urgent problem and get evaluated quickly, because early diagnosis and treatment help prevent complications. Sometimes there is no clear cause, and doctors call that idiopathic, which is a medical way of saying we cannot find the trigger. Other times, iritis is linked to immune system or inflammatory conditions, including groups of arthritis-related diseases often associated with a gene marker called HLA-B27. It can also happen after an eye injury or trauma, like getting hit in the eye. Infections can also trigger uveitis and iritis, including viral and other infectious causes, and this is one reason you do not want to self-treat with leftover drops. The bottom line is that iritis is not always just an eye problem, and part of good care is checking whether something else in the body is connected to it. Because the symptoms can look like other eye conditions, diagnosis is based on an eye exam, not guesses. An optometrist or ophthalmologist will examine the front and inside of the eye using a special microscope with high magnification called a slit-lamp. Depending on your story and what they see, they may recommend additional tests to help pinpoint a cause, especially if attacks recur or if there are symptoms like joint or back pain. Treatment usually focuses on calming inflammation fast and preventing damage. For many cases of anterior involvement, doctors commonly use steroid eye drops to reduce inflammation. They also often use pupil dilating drops, sometimes called cycloplegic drops, which can reduce pain and help prevent complications from the iris sticking where it should not. If the situation is more severe, chronic, or not responding to drops, treatment can escalate to steroid injections near or inside the eye or to medications that affect the whole body, like systemic steroids or other immunosuppressant medicines, once infection has been ruled out. The important patient point is this. You must use the drops exactly as prescribed and show up for follow-ups, because complications can include high eye pressure, cataracts, or retinal swelling. If you found this video helpful, consider subscribing and checking out the next video.